Hi, my name is Anna Penny. I'm 15 years old and I'm a Year 11 student attending Kapiti College. My story starts way back on September 2014. I only remember this date because it was my best friend's birthday. I woke up with an uncomfortable pain in my lower abdomen. As the day went on, the pain grew, and just like that, I found myself in Wellington Hospital's theatre with suspected appendicitis. I had my appendix taken out, and after waking up after surgery, being very mad the doctors took my underwear without my permission and thinking I was Queen Elsa from Frozen, I was on a lot of drugs. I was told my appendix was fine and healthy, but that they also looked at my ovaries, and it looked as if I had had a burst cyst, which could have been causing the pain, but was told it was nothing to worry about. A few nights after spending long nights in Wellington Children's Hospital ward, listening in on the Disney movies being watched, the crying babies, and having to squeeze my long-legged self into those tiny children's wheelchairs every time I needed to use the bathroom, I was back home in bed for the next 2 weeks. I didn't miss any school because it was the holidays, so woohoo! That was covered in cards, flowers, and chocolate from all my friends and family. The weeks went on, but the pain continued for the next year, with many visits to hospital, scans, blood tests, tubes and cameras through me, yet I was never diagnosed. The pain was horrible and I couldn't stand, which led to me missing altogether an entire term of school. I visited a paediatrician and assigned me to a child psychologist, as the pain was thought to have been led on by my anxiety. The pain grew into not being able to stomach food, either vomiting or going to the toilet even half an hour after I had eaten and having blood in my stool, which proved it was not my anxiety at all. More tests were done and still everything was clear. For me and my family, this was super frustrating, as I felt I was getting nowhere and this pain was going to haunt me forever. I was missing out on a lot of social things, but also increased my anxiety and sparked depression. In August 2015, I started to get horrendous head pain, which kept me in bed full time. I was lucky enough to be up for an hour a day. We visited my GP at least once a week, asking for more to be done/checked, because I was experiencing more symptoms. We thought there might be a higher chance of working out what was wrong. Still, only blood tests were done. I was given nothing for the pain and had basically nothing going on to inspect what was happening to me. I felt very tired and useless, and as if no one really cared about what I was going through. By now my parents could see me losing my usual happy, bubbly self and slipping further and further into depression. In August 2015, I woke up with severe head pain. I was light and sound sensitive and was taken to my local GP, where I was then put into an ambulance and taken once again to Wellington Hospital. The head pain was at first thought to have been related to the tummy pain, but after 3 days of being in hospital, my knight in shining armour, also known as Tim the occupational therapist, came in to visit me and said, "I have been looking through your records and saw that in August you came into A&E with a broken hand and a knock to your head after playing a netball tournament." And then suddenly everything came clear. I had hit my head 3 times very hard within 45 minutes playing a netball game. I had also injured my hand. I went over to the paramedics on site at the time, but the main focus was on my hand, and I was told to go and get checked out. After spending 6 hours waiting to be seen in A&E, my head was pounding, I felt sick and fell asleep for the majority of the time. I was finally seen. My hand was the main focus. Although I was complaining about my head, I was told, "Well, you've been here for the period of monitoring time required, so you won't have a concussion," even though I hadn't been monitored at all. And of course, my mum and I listened to what the professionals had said and carried on with life. Although I had extreme pain for the next months, we hadn't really thought about it. Tim asked me what symptoms I was experiencing. I told him exactly what I had been telling everyone for the past 3 months. Dizziness, constant headache, nausea, lack of concentration, irritable, and memory loss. He was shocked that no one had picked up on my post-concussion syndrome. It was great to finally have some understanding of what was going on with me, as to me it meant recovery. So now I was faced with post-concussion syndrome and my mystery tummy pain. I shortly began to see ABI in Tawa, the rehabilitation service, to help me get back into school and life in general. At this stage, I was still spending majority of my time in bed and not being able to participate in anything requiring too much brain effort, so I was limited to baking and sleeping. Sounds great, I know, but it got very boring very quickly. Once I was able to be awake for longer periods, I started health school, where I was visited in my home twice a week to catch up on schoolwork. My life was eat, sleep, work, repeat. This alone was causing depression, and unfortunately head injuries also add to this. My friends stopped visiting me and I felt very alone. Of course I had wonderful family, but friends are different to family, and was soon left with no friends at all. I couldn't work out what I was doing wrong. I was told that they felt I was never there for them, that how could I be when I wasn't there for myself. The people I called my friends turned on me suddenly, starting rumours I was fake sick. This is the problem with hidden illnesses. You can't physically see it, so everyone assumes you're pretending. I was also being bullied, receiving threat texts to watch my back, and so on. The people I had once called my friends were now very opposite to that, crying to my mum every night and started a habit of self-harm. I decided I needed help. I told my mum what I had been doing to myself. For me, this was really hard as I felt I would disappoint them or, yeah. The next day she took me to my GP, where I completed a suicide risk assessment. The score was alarmingly high. Yet I was told to go see the doctor at AB High, who was sorting out my medication, and to ask for an antidepressant. So the following week we did. Whilst this was happening, I was also diagnosed with chronic migraines due to my head injury, which the hospital had missed. I was also told I would be given an antidepressant to help, but they never came. In early December, still facing the bullying, I had many messages to go and kill myself. One night everything all got a little too much. I wrote a suicide note saying, "I love you, this is not your fault, there is nothing anyone could have done, I will miss you." Grabbed the sheet of tramadol I could find from, tramadol was from the hospital, yep. Swallowed the remaining 7, took a knife from the kitchen into my bed, lay on my bed and closed my eyes and prayed to die. I was alone, empty, and felt extremely useless, as if everyone would be better off if I was gone, as if I would be better off if I was gone. No one wanted me, no one cared or wanted to help, and I felt like the pain was never going to end, both physically and emotionally. I wish I could say that after my actions I instantly regretted it, but I didn't. As I lay there with tears streaming down my face, all I could think about was how hurt my mum, dad and sister would be, and how confused my little brother would be. I knew they loved me, but I still felt I was bringing them down. I walked out to go to the kitchen again, but I saw Mum sitting on the couch. I told her what I had done, and she got very upset. My dad came down from upstairs, and they called the ambulance. The whole time I sat very still on the couch, not saying a word, silent tears running down my face, but I still continued for the drugs to kill me. The paramedics arrived and they were very kind. Dad followed us behind in the car to the hospital. At this point, I was wanting more than anything to close my eyes and never wake up. Once we reached the hospital, I felt sick, vomited a few times, lay in the hospital bed out in the ED corridors, and suddenly reality hit me. I felt ashamed of myself, embarrassed that it didn't work. As I lay there with a million thoughts racing through me, one of my favourite nurses came over to me and asked why I was back. I told her, and as she stroked my hair, she told me, "Just keep swimming, Nemo." Those words will probably stick with me forever. The next day, I was visited by the CAT team. They got me into Headspace for the next couple of days, set me up with cams and got me an antidepressant. It was sad that having to go that far got me the help. As I was in Headspace, somehow people found out about my attempt and I was sent messages like, "Try again, you waste of life." I felt dead. I sat in Headspace by myself and a song came on called "A Little Too Much" by Shawn Mendes. The lyrics go, "Sometimes it all gets a little too much, but you gotta realise that soon the fog will clear up and you don't have to be afraid because we're all the same and we know that sometimes it all gets a little too much." Those words are exactly what I needed to hear, and right then and there I promised myself to get help. A few days later, I was back home, still feeling lonely but had major support from my family. The bullying continued, but I was now getting help to try and face that. As the weeks went on of appointments with ABI CAMS, my school and health school, we worked out a plan to get me back into school for 2 hours a day, as we felt this might help. Over the last few weeks of the Christmas holidays, I reconnected with a few people and found that these bullies were doing similar things to them too. I started back at school and my friend group enlarged. I felt back into life and was feeling happy again. Obviously, it was frustrating how long it took / taking to get fully back into normal life, but I am more than ecstatic to have got as far as I am now. I see CAMS and ABI as of next term, I am in school for 3 hours a day, have the best friends in the entire world, and able to play netball again. Not too long ago, the search of the funny pain was resolved by calling it chronic irritable bowel syndrome. So that's the basics of what I went through over the past couple of years. My recent goal is to join or start an awareness campaign of the bullying that comes along with the lack of understanding illnesses, along with depression and anxiety within adolescents. The amount of people I have talked to that don't get it is astounding. Anxiety is more than just worrying, depression is more than just sadness. It is a flood of emotion, but one that you do not choose to feel. By sharing my story, I hope to encourage others to get help and to express that the way adolescents are currently treated within our health system is concerning. Thank you.